I think people that go into healthcare are probably among the most driven people that there are. They're very special people. People are almost angels, I think.
I really do. I admire them. It takes a special person to care like that.
To have this team of caring professionals who listen, and then we're willing to step forward and provide their expertise. That gives you strength.
You know, I've got another opportunity here to just keep living my life and do all the things that I want to do. And if it wasn't for the folks here at Essentia, I wouldn't be doing that. I would not be alive. So that's, what more can you say than that?
I think of our Essentia team as kind of a big orchestra, and we are all really playing a different part. So whether you're in direct patient care or whether you're in a support role, it's just important that we all play our parts flawlessly every time and not miss a beat for our patients.
There's more going on than just one person. It's, a group of people working together with many hands in front and behind the scenes.
No role is more important than the other. It doesn't matter if you're a physician or if you're answering phones at the help desk.
I mean, it's a whole team, from start to way after the finish, to months after the finish.
Knowing that even though you're behind the scenes, the work that we do contributes to the overall success of the organization is just the most amazing feeling.
We all have a part in caring for patients, whether you're at bedside, whether you're within an office capacity, whether you're serving food. We all touch patients, and it's important that we all live out the values, because those values are what guides us each and every day.
Our values came from our Benedictine sisters, from our Benedictine roots. The values of hospitality, respect, stewardship, and justice were the values that they brought to us. And then later, when we became Essentia, the values of teamwork and quality were added as the bookends. And so those values are all kind of tied up with our mission, and that makes us who we are.
And I think that's the difference maker, is our ability to carry out and live out our values every day in everything that we do.
So I would ask each and every one of us, whether it's your first day or you've been here 30 years, take a look at the values. Find out, number one, what they mean to you. Consider what they might mean to the people that we serve. And then take some time and say, what are the type of behaviors that I see that embody those values? And what are the type of behaviors I'd like to set for myself to embody those values?
Our mission is, we are called to make a healthy difference in people's lives. That phrase, we are called, is so powerful, because I think people that go into patient care do it because of finding a deeper purpose, finding a deeper meaning, finding joy in their work, and I really think it's kind of part of our DNA.
Yeah, called to make a healthy difference in people's lives. I like that. I do like that, because that is what I feel, that is how I feel I got into medicine. I do feel like I was called into medicine.
And it doesn't say the doctors are called or the nurses are called. It says we collectively. And so there's this sense that we're all in it together.
It's easy to remember, we're called to make a healthy difference in people's lives.
A healthy difference isn't always a medication. It's not always surgery. It can be counseling. It can be just listening sometimes.
We're called to make a healthy difference in people's lives. I mean, we spend so much time of our life and days at work. It's nice to have a clear understanding of what the goals are, where are you going, and why are you doing this for.
If we don't get the mission and values right, if we are not walking in those steps, nothing else will happen. That is the must. That is the must-have for all of us.
Oh, my badge. Yes? You like my badge?
I really am proud of my badge, because it says that I'm part of this Essentia team, and that means a lot to me.
You're part of a fantastic place of people that do anything and everything they can for the patient, and that at the end of the day is what it's all about.
I swipe my badge for others. That's one of the fun things I do. I love to pay it forward at the cafeteria. I go to the cafeteria and I wait for someone to pull up behind me, and then I'll say, I'll get theirs too. It's like a shot of adrenaline, and it kind of stays with you the rest of the day.
There are days that our job is hard, but there are way more days that our job is really fun.
I always tell everybody, you know, healthcare is one of the best fields to go into because there's so many different areas to go into it. And to find what fits them not only professionally, but personally. And you can find that in healthcare. You can find that at Essentia Health.
My main job is to do home visits and try to keep patients out of the hospital. I've had a lot of joy in developing this program. I like to see patients getting better. I like to see the post-ambulance side of things, and I get to spend a lot more time with those individuals. This being a brand new program to the United States, or fairly new, and to see Essentia really run with it, I find a joy in that.
I am a maintenance engineer. Yeah, I do volunteer twice a month to say the morning prayer at 7 a.m. Every once in a while you might choke up a little bit. Maybe the prayer touches you a little deeply, and you experience the prayer as much as someone else listening to it.
As Child Life Specialists, we work with children and families to help them cope with hospitalization, illness, anything that can happen in a healthcare environment. I was part of the team that built this program and developed where we provide services and how we provide them. I love my job. I see it as a privilege.
Why am I here? That's a really deep question. I mean, when you stop and think about it, why am I here?
Wow, I should have thought about that one.
Here at Essentia Health, we're here to support children and families in any way we can, each and every day.
We are here for the patient. We are here to get to know their needs, not the way we see it, but the way they will tell you.
I mean, these patients become, I mean, we see them so much, and they're in the hospital. I mean, you become part of their family, which is at first awkward, and then it's kind of honoring. You're like, these people really trust you.
I just think that when you can form a connection with somebody within 10 minutes of meeting somebody, and then you're here to support them throughout the whole procedure, and then you might see them a couple weeks later. For me, it comes easily, and I'm honored to have that privilege.
I really feel that I've been called to be here. So it's great when you can be a part of something big like that and help people.
I'm here because I believe in the mission and values of Essentia. I'm here because I feel like I'm a valued member of the team.
Honestly, right now, I can't imagine doing anything else. I think there are just some people that are destined to help others. I find a lot of joy in that.
I really think the vast majority of people who work here really work here because they care. We're making a difference, and we're making a difference every day.
We have a tremendous opportunity not just to address the healthcare needs of the communities and the people that we're privileged to serve, but to show the rest of the country how to do it.
Why am I here? I'm here because it's the best around, and I want to be part of something like that. I don't want anything less than the best. That's why I'm here.
I can't imagine doing anything else. It's about making a difference in the lives of our patients, like my colleagues have made a difference in my life. 2 weeks ago, my second grandchild was born here, so just that joy and compassion that they've shown to my family in that instance. 2 years ago, they were also with me at the end of the life of my mom, and such incredible compassion I've never felt before. And so when I walk down the hallway and I see my colleagues passing by, they're the folks that I work with. They're also the people that have taken care of me and my family. And I don't know if they know what, sorry. I don't know if they know what a difference they've made in our lives. I feel like we're linked by this kind of invisible thread. And when I pass them in the hallway, I really send them silent blessings of gratitude for everything that they've done for me and my family.